Michael Peolsson, and I will talk briefly about the Swedish perspective when it comes to the European health data space, some challenges and opportunities, and how Sweden is preparing for the EHDS. So I start with, in Sweden, our main challenges would be fragmented health data landscapes, lack of national infrastructure, legal challenges, and interoperability. Not unusual, I guess, but Sweden has a very long tradition creating registers. And I hope we will beat our Danish friends when saying that we started around 1650 with our so-called church books, where it was one of the first medical records where different medical history were stored. And however, we were quite poor on digital solutions and digital health strategies at the time, so we started a renew register process in around 1960s, and the EMRs around 1985 and onwards. So we have a very long tradition of collecting data and try to sort them out and make good categories, and also a great deal of quality work, how to use them for both primary and secondary purposes. But we are very poor of national infrastructure, and we are beaten by the Danish friends in that context. I would definitely say we envy you how you have created the national infrastructure for all your data in Sundes Datastyrelsen. But we share also the legal challenges with many of you, and I am a task leader for one of the Tehdas tasks, where we are aiming at national legislations for secondary use. When this happens, what kind of preparations and guidelines would be appropriate? And that is a quite humble task for us to give some kinds of guidance or checklist what to take into consideration when a certain country is planning or discussing how to approach secondary use for health data. Interoperability, I will come back a little bit about that, but I would say that all four dimensions of interoperability is of significance when we are talking about the main challenges in Sweden, although we strive along in that path. So European health data space for Sweden, we really look forward to this, and we see that in the increase of standardization and interoperability work is highly valued, both domestic wise and EU wise. And we see also that we have been part of both primary use and secondary use for many years, and the e-prescriptions, which the Swedish eHealth authority is responsible for in Sweden. We work a lot with the cross-border patient perspectives, how to integrate eHealth at the EU, but we also prepare for patient overviews and new categories, of course. But we also see that there are some, at least initial costs, to make this happen in the real world. We see also constitutional amendments. How can we align and harmonize different kinds of legal frameworks? How can we harmonize the legislative train when we look into the digital Governance Act and the Data Act and AA Act, and also the MDR regulations. We are also approaching some kind of national authority organization. It hasn't been decided by our government yet, but we think that will be we will see that in the next month, perhaps, who will be responsible for all this. when we assure, we also think that when it comes to being a national part of this landscape as a digital health authority, or as we are an eHealth authority, it's important to see all the requirements back from the regulation perspective, how to implement interoperability in everyday practice, I would say, when it comes to health data exchange. And we see in the EHDS also the telemedicine services that could be also of great benefit for Sweden. We haven't come a very long way when it comes to telemedicine. In Sweden, we have not just one system. We have 21 regions and 290 municipalities, and they are all autonomous, even politically elected and autonomous. So they decide what kind of resources they will put forward and what kind of solutions they will develop. When we look at the health data access body, we are preparing for this access body as a node, one door into the Swedish health data landscape, although that data are not perhaps traveling around. So it's a federated system we are looking into, and how to create an interconnection and how to manage one door for managed applications or support EU authorities in their tasks, but also how to collaborate with data holders in a secure way and the secure processing environments and so on. And we are also come quite a long way with a meta catalog, and I will come back a little bit to that. So we shall select the national node for secondary use. And the national process then, the proposal will be sent out for consultations, and there is an openness around this referral responses, and we are taking part in the dialogues with the Commission now. So if I summarize this part, when we are talking about digital transformation journey in Sweden, we are looking into what suggestions come from the European level, both from vision-wise or policy-wise. But then we have to look into the governance strategies and also the digital health data strategies and European law. And they will look how can we harmonize this view with the national view. We also have national visions and policy for digital health strategies and other strategies, of course, and we will look into how health data strategy could be harmonized with the European levels and also national laws. So that will end up as when I begin with the interoperability, we need to have this legal interoperability in place. We need to have also a policy interoperability, which is not too often mentioned, but also the technical and organizational and semantic interoperability, of course. We are taking part in all three EU projects for EU for Health, both joint action primary use and direct grants primary use and secondary use, and we are competent authority for these applications. We also prepare ourselves by way of 3 national inquiries regarding health data, one looking into the national resource for future healthcare and how health data can be part of this. We are looking into investigation of e-prescription and patient overviews within the AI and health data as national interest when it comes to legislation interoperability. And these inquiries will end in next year and the year after that. We are also preparing for, by way of government assignments, to carry out pilot study on national infrastructure for quality registers, but also for a new governmental national data space for diagnostic imaging, and thirdly, a basic data domain. The last thing I would like to mention as for the preparation from Sweden is that I have been also part of another task led by Sensano, the Public Health Institute in Belgium, who has been mapping some 12 member states in the EU around the health data landscape and mapping the health data landscape in each country. So they have been doing a tremendous fine work how to look into each other's prerequisites and how to make use of the specific country reports, which is performed for each and every country, but also country fact sheets which are publicly available. And I was hosting our own Swedish country visit just 3 weeks ago. And this has been a very important input for our preparation for the next steps. When looking into the landscapes, we are looking at these categories, mainly overview, infrastructure, governance, storage, data quality, and resources and information systems. So when we have mapped all these, we have gathered some 27 stakeholders in Sweden, and they came to us and described what they were doing, how they prepare for secondary use of health data. And our Belgian friends are condensing this, summarizing our efforts, and bring it back to Sweden as a next step for our preparation, so to speak. And I thank you there. Thank you so much.